This module is dedicated to exploring vocal pathologies and disorders, offering you the foundational and advanced knowledge required to identify, understand, and appropriately respond to voice-related abnormalities. It bridges the gap between vocal wellness and clinical concern, emphasizing how to distinguish between fatigue and injury, and when to seek professional help from voice specialists such as ENT doctors, speech-language pathologists, SLPs, or vocologists. The module integrates insights from clinical otolaryngology, speech pathology, performance medicine, and vocal pedagogy to present a well-rounded, in-depth perspective on vocal dysfunction. It includes medical terminology, symptomatology, risk profiles, diagnostic methods, treatment modalities, and case studies. Whether you are a singer, public speaker, coach, teacher, or voiceover artist, this module empowers them to become proactive custodians of their vocal health, capable of early detection and prevention of serious voice conditions. Key learning objectives. By the end of this module, you will be able to define and categorize various types of vocal disorders, understand the anatomical and physiological causes of voice disorders, recognize early warning signs of vocal damage or pathology, identify functional versus organic versus neurogenic voice disorders, understand common diagnostic tools, laryngoscopy, stroboscopy, acoustic analysis, outline treatment protocols, voice therapy, surgical interventions, medication, apply preventive and rehabilitative strategies to minimize risk or recurrence, know when to seek specialized voice care from a medical professional. Section 1. Understanding vocal disorders. Vocal disorders refer to any impairment, disruption, or pathology of the voice-producing system, affecting quality, pitch, loudness, or effort. 3 major classifications. Functional disorders arise from vocal misuse, overuse, or behavioral issues. No visible anatomical damage initially. May lead to structural changes over time. Examples: muscle tension, dysphonia, vocal fatigue. Organic disorders caused by structural changes in the vocal apparatus, physically observable via laryngeal exam, may require surgery or medical treatment. Examples: vocal nodules, polyps, cysts, papilloma, laryngeal cancer. Neurogenic disorders linked to neurological dysfunction, impaired nerve signaling to the laryngeal muscles. Examples: vocal fold paralysis, spasmodic dysphonia, Parkinson's-related dysphonia. Section 2. Common vocal pathologies. 1. Vocal nodules. Bilateral, callus-like growths at the midpoint of vocal folds, caused by chronic misuse, yelling, poor technique. Symptoms: hoarseness, breathiness, pitch breaks. Treatment: voice therapy, behavioral modification. 2. Vocal polyps. Unilateral, fluid-filled lesions, like a blister, may result from acute vocal trauma. Symptoms: roughness, vocal effort, vocal fatigue. Treatment: often surgical removal plus voice therapy. 3. Cysts, encapsulated masses beneath the vocal fold surface. Symptoms: persistent hoarseness, loss of vocal flexibility. Treatment: surgery is often required. 4. Laryngitis, acute or chronic, inflammation of the larynx due to infection, overuse, or irritants. Symptoms: loss of voice, sore throat, dry cough. Treatment: vocal rest, hydration, anti-inflammatory meds. 5. Muscle tension, dysphonia, MTD, excessive laryngeal tension without organic cause, often stress-related or technique-based. Symptoms: strain, tightness, inconsistent voice. Treatment: voice therapy, relaxation techniques. 6. Vocal fold paralysis. One or both folds fail to move, caused by nerve damage, surgery, stroke, tumor. Symptoms: weak, breathy voice, aspiration risk. Treatment: surgical medialization, reinnervation, therapy. 7. Spasmodic dysphonia, involuntary spasms of the vocal folds, neurological in origin. Types: adductor, strained, strangled voice. Abductor, weak, breathy voice. Treatment: Botox injections, therapy. 8. Reinke's edema, swelling of the vocal fold cover due to smoking or irritants. Symptoms: deepened pitch, vocal roughness. Treatment: smoking cessation, surgical reduction. 9. Laryngeal papillomatosis, wart-like growths caused by HPV. Recurrent, may obstruct the airway. Symptoms: hoarseness, difficulty breathing. Treatment: repeated surgical removal, antiviral therapy. 10th. Laryngeal cancer, often related to smoking and alcohol use. Symptoms: chronic hoarseness, pain, difficulty swallowing. Treatment: surgery, radiation, chemotherapy, vocal rehabilitation. Section 3. Recognizing early warning signs. Red flags that should never be ignored. Hoarseness lasting longer than 2 weeks. Sudden voice loss or pitch drop. Voice fatigue after minimal use. Pain while speaking or swallowing. Difficulty projecting or sustaining pitch. Breathy, rough, or strained vocal quality. These symptoms often precede serious vocal issues, and timely intervention can prevent irreversible damage. Section 4. Diagnostic tools and techniques. Voice professionals work alongside ENT doctors or laryngologists using laryngoscopy, direct visualization of vocal folds using flexible or rigid scope. Stroboscopy, slow motion analysis of vocal fold vibration. Acoustic analysis, measures jitter, shimmer, pitch range, loudness. Electroglottography, EGG, measures vocal fold contact. Aerodynamic testing, evaluates airflow and pressure during phonation. Early diagnosis is essential for treatment and voice recovery. Section 5. Treatment and Management 1. Voice therapy provided by licensed speech-language pathologists, SLPs. Targets: vocal behavior modification, breath support, resonance balancing, muscle relaxation. 2. Medical or surgical interventions, anti-inflammatory medications, e.g., corticosteroids for laryngitis. Surgery: microflap surgery, laser excision, or medialization techniques. 3rd, Botox injections, used for spasmodic dysphonia, temporarily relaxes overactive muscles. 4. Holistic support, hydration and vocal hygiene, stress management, rest and sleep, nutritional support. Section 6. Prevention and long-term strategies. Warm up before every performance. Cool down after prolonged use. Avoid shouting, whispering, or throat clearing. Stay hydrated, 2 to 3 liters of water per day. Manage acid reflux, allergies, and respiratory infections. Use amplification in large spaces, microphones. Schedule regular vocal health assessments. Section 7. Collaborating with voice care teams. A voice care team may include ENT and laryngologist, speech-language pathologist, vocal coach and vocologist, primary physician, psychologist, for stress-related conditions. Interdisciplinary care ensures best outcomes in both recovery and prevention.